Hello, my name is Bilbrey. I'm excited to be here with you today to share some information on the history of nursing and how the field of nursing has evolved over the years. I look forward to answering any questions that you may have following my presentation. The field of nursing is just like any other in terms of change. It's always evolving. Three specific things I would like to speak to you about is nursing in the past, nursing in the present, and the future of nursing. In 1850, Florence Nightingale began her studies as a nurse. She soon went on to develop the field of nursing into the profession it is today, rather than just a set of job duties. In this time, she also developed the first standardized uniforms for a nurse. In the past, nurses were often female, so their uniforms consisted of full-length, long-sleeve dresses with white caps. Gloves and masks were very uncommon in this time as they were thought to only be used in sterile situations such as surgery. Some duties of a nurse in the past included assisting their physicians. Often they would follow their physicians around as they went to see their patients, and they would carry the physician's charts and keep their notes for them. They're also responsible for sweeping and mopping their patients' floors, dusting and cleaning the chimneys, washing windows. They were also responsible for daily baths and back rubs for their patients. Patient stays in the past were much longer than they are today. Patients were given the option to stay in the hospital and recoup and get back on their feet before they were sent home. The daily baths and back rubs were just a way to keep the patient comfortable in their stay. Education of a nurse in the past consisted of a 1-month in-hospital training. Associate's degrees were also very common as they were thought to get the nurse quickly trained and on the job. Fast forward to nursing in the present. Today, nurses wear what's called scrubs. These are comfortable, lightweight material that's thought to be easily cleaned if contaminated. Gloves, masks, and gowns are often daily worn in the profession of nursing today. They are thought to be universal precautions that protect the nurse and the patient from what they may come in contact with. Some duties of a nurse today include consulting with their physicians rather than just assisting them. They're also responsible for establishing treatment plans for their patients and performing diagnostic tests and administering medications. Education for a nurse today has been moved to universities, and oftentimes nurses get bachelor's degrees. Although LPN schools and associate's degrees are still obtainable. No matter which route you choose to take, passing of the NCLEX, the state board test, is a requirement to be licensed. The future of nursing is heading toward a crisis, and this crisis is a shortage of nurses. This shortage is due to an aging population, increased prevalence of chronic disease, and a limited capacity in nursing education programs. Although the field of nursing is growing, the demand for nurses is growing so much more. By 2020, there is expected to be 800,000 vacant RN positions in the U.S. In closing, I would just like to remind you the field of nursing is always changing. Nurses in the past drastically differ from nurses in the present, and the future of nursing will just continue to change. I'd like to thank you for your time and attention, and I look forward to answering any questions that you may have.